Hi, everybody. Welcome to My Other's Keeper. I want to welcome today some awesome young ladies. And I say they're young because they're younger than me. Chrissy is from the U.S. You're in Ohio, right?
Yes.
Yes, you're in Ohio. Samara lives in Saskatchewan, same as I do. And we all have diabetes. Yay!
It's a fun club.
Well, or former diabetes,
Yes.
as Sam will say. So let's introduce ourselves. Let's tell a little bit of our diabetic story, and let's just have a chat. So, Chrissy, why don't you start?
All right. Well, my name is Christina. I also go by Chrissy. But my story started when I was 13 years old. I was having some kind of medical issue that was not going away. And I was like, okay, I'm going to need to go see the doctor about it because I don't know what else to do. Went to go see the doctor. And he said there was a couple of things that could be wrong with why I was having the same medical issue. And one of them was my sugar being elevated. So, so they tested my sugar, and it was 350, which is not good as a non-diabetic. Um, so basically, my mom came back to me and said, "We're going to the hospital because you cannot go home with this high of a sugar level." So I went to the hospital, got checked in, everything, got up quickly to my room, and I didn't even get settled in my room. And I remember this vividly. I didn't get settled into my room before they came up to me and said, "You're a diabetic." I felt like I got hit by a truck. I barely in the room, maybe 5 minutes before they came in. So it was pretty quick. And again, I was 13 at the time, so I was pretty young. Um, and so I'm a type 2 diabetic, which it can be very good because a lot of times if you lose some weight that you have on, you can pretty much live a normal life and not have to deal with a lot of symptoms and high sugar levels. So that is my story. I was a juvenile diabetic, but I'm coping with it, and it's not too bad. It's not the worst disease you can have.
All right. Thank you. I'm going to do mine as well because we have a very different story. There we go. We have a very different story than Sam does. So mine was in my 30s. I was doing everything right. I had been losing weight. I had been eating properly. I had been doing all sorts of things. And my husband and I got a physical done because we wanted to get some insurance. And so we did our physical. And about a week later, we got a message back from the nurse and said, Kim, you might want to go get checked. According to my calculations, your blood sugar's high. I'm like, okay. So I went to my doctor and I got checked. I was teaching in the afternoon and in the evening. So I was right between the two times when I was to teach. And so I went after having taught in the afternoon, went to my doctor, and he's like, Kim, let me test your blood. So he gave me a poke, tested my blood, looked at my A1C. So that's the 3-month level of what your blood sugar is doing. And my 3-month level was like way up. Now, Chrissy, you talk about 385, you said?
Yes, and by the time I went to the hospital, because they tested it there, it was like in the 400s.
So
Okay.
400
Now,
is about 22, Kim.
okay, because in Canada, we measure on a different scale, much like Celsius and Fahrenheit. So we measure on a slightly different scale. Yours would have been about a 22. My A1C was about 15 or 16. And what would that be for her, Sam?
15 or 16 would be about 270 up, 270 to 325.
Okay. Yeah. So my A1C was very high as well. And my my family history, my mom's side, everybody's diabetic. My dad's side, everybody's diabetic. It, like yourself, it wasn't a matter of if, it's a matter of when it's going to happen. And it just happened to hit at that point. So
My mom
we
said
just,
marker. Sorry, my mom said I had a marker for it a year before.
oh, okay. Okay. Yeah. So, I mean, it was weird because then I went to the doctor. We went to an endocrinologist, and that doctor said, you know what? Doesn't matter if you are 100 pounds or 500 pounds. It doesn't matter if you are 25, 85, 5. It doesn't matter. When your pancreas gives out, your pancreas is going to give out no matter what. And that really helped with my husband because he was of the impression that with diabetes, it was all to do with lifestyle. And if you eat lots of sugar, you're going to get diabetes. Well, that's not the way it works.
That whole, oh, did you eat too much sugar as a kid?
Yep, exactly. Exactly. So that was kind of where I went. So I have been type 2 diabetic since my 30s. I don't remember exactly how old, but somewhere in that area. Yeah, I've been treating it with oral medications. I had to go on insulin after a major panic attack in 2015, April of 2015. I had no idea that a panic attack could spike your sugar levels so badly that you would have to permanently be on insulin. I had no idea. So learning that was a bit of a kick in the head. And yeah, that day that I found out initially that I had diabetes, again, it was like this whole big boom. And I was not panicked, but I could not stop crying. It's like, what is going on? It was this loss of a life, I think, that I had. And yeah, so I had to go on to, in 2015, I had to go on to not only oral meds, but long-lasting nighttime insulin. And then about 3 or 4 weeks later, another major panic. And this was all to do with this bullying situation I had at work, which ended up in me being having a nervous breakdown later in the year. But that made it so that I had to go on mealtime insulin as well. So I had no idea how stress levels were so closely tied to your sugar levels and how well your body is going to work through things. And I'm just going to quickly say hi to Josh, Kirk, Mary, Kathy, Sandy. Thank you all for coming. Nice to see you in the chat. If you do have questions, please let us know. We will end up covering Samara's face with your question or comment. Josh is a diabetic as well. And when he was diagnosed, his numbers were so high that the hospital machine was reading high. Oh my goodness. Wow. Yeah. When I had my nervous breakdown, my sugar levels were probably in the 500s or more in American terms. In Canadian terms, it was around 30. So I don't know what that would be. Sam, are you doing the math?
30 is about 540. I'm looking at a table.
That works. All right. So yeah, when I had my nervous breakdown, it was just horrific. So Christina, be very careful when you have stress and that kind of stuff. Pay attention. Take your blood sugars. Do your poke thing. Because man, it can go like that real quick. Okay, so Sam. Sorry, go ahead, Chrissy.
I said I agree. I do need to do better at testing. It's often hard. You have to break yourself because eventually it hurts and leaves your finger with, I call them finger freckles.
Okay, see, I don't ever get that.
Where do you poke your fingers?
Yeah.
Do you do the sides?
I usually use this finger.
But like, do you do on the sides or do you do like in the plushy part of your pad?
The pushy part.
Okay. Because I know that in the hospital they like to tell you to do the sides, and that hurts.
That hurts.
That hurts. I'm
It really
sorry, that
does.
hurts.
Okay, you see this twitching? That's because of a medication I'm on, and it makes me twitch just randomly. So anyway, just thought I'd throw that out there. But yeah, I do mine just kind of off to the side of the pad. So it's not in the center,
Yeah.
because then when you grab something, every time you push down, you're going to feel it. But just
Yeah.
off to the side of the pad, so it's
Yeah.
still in the fleshy parts, and
Okay.
so it doesn't hurt as much.
As
As
we were
well,
yeah.
sorry,
Just gonna say, as we were discussing before, every single person is different.
absolutely. As well, though, I have to make sure that the depth of my lancet isn't too high. I only have mine at 2.
Yeah.
Um,
Go too high on your lancet, it hurts. And
oh man, yeah.
there's been a couple times I've not realized I've set it high, and it's like, man alive, that hurts.
Oh my god, it came out the other side.
Yes. So they had to do the old blood work test. So Sam can tell us more about the old blood work test, because she had diabetes from the time she was 3. And yeah, so that's,
Yeah.
go ahead, Sam.
So-
Let's hear your
So my
account.
story is, when I was 3, my
Mhm.
mom started recognizing the symptoms of diabetes in me because my dad was a type 1 diabetic as well. He was diagnosed at 10. So she talked to our family doctor about it, and like on the phone, and he said, yeah, just take her into the hospital first thing in the morning when she hasn't eaten anything yet and get her tested. So we trek on down to the hospital, and we were still there when he came in to do his rounds at 6:30, because they hadn't done anything because they wouldn't listen to my mom and believe her. She was just an irate, crazy mom. And she's like, no, I'm
Yay.
not. My husband's a diabetic. I know what these symptoms are. I know what's going on. No, she's just a cranky little kid. Don't worry about it. So when my doctor got there, he's like, what are you guys still doing here? And yeah, he got stuff moving. So from there, at that point, we didn't have like finger poke blood tests. We had to do urine tests. Those are fun. You basically had a little glass test tube, and you had to drop her in so many drops of urine. And then you had a little fizzy tablet that went in there, and it bubbled up, and the glass got incredibly hot, and it changed colors. And then you match the colors on the chart to what the sugar content was in your urine, basically, by how much your body was dumping out. Great.
Mhm.
So when blood testing finger pokes came around, the sound those machines made horrified me. I was scared to death of them. Needles, no problem, but that scared me so bad. So yeah,
Hmm.
my resort was, I'll poke my finger when Grandpa does, because Grandpa was a mechanic and a farmer and all that kind of thing. So he had like skin that was like an inch thick. So he'd sit there and get poked over and over and over and over and over again until he finally bled enough to do a test. And then I was like, okay, Grandpa did it. I'm okay. I'll do it. But I'm sure the neighbors thought that they were killing me because I'd scream and cry lots because I didn't want to do it. And we later determined it was the sound of the machine releasing the lancet that was getting me.
Was it like a click? Is that what?
It made like a thunk noise.
Oh,
Yeah, like it literally goes
okay.
thunk when it let go of it. And there was no depth setting when they first came out.
Right.
So,
Yeah.
ouch.
But it must have been so much more accurate as well, though. No?
No.
Oh.
We had a bottle
Mm-hmm.
that our test strips came in, and it had, I think there was about 8 little color bars that you matched your
Mm-hmm.
strip to determine your blood sugar. And at that point, we measured in the same system as the states,
Okay.
which is why I'm not quite as lost when I'm talking to somebody from the States about blood sugars, because
Right.
that's how I learned to do my blood tests.
Yeah.
So yeah, anyway, grew
Yeah.
up kind of thing. Went to camp at 7, which is when I got to learn how to do my insulin and do my blood test myself and that kind of fun stuff. Camp Easter Seal is awesome for anybody who lives here. Camp Easter Seal is an abilities camp for those who don't live here. And they have all different medical condition people can go there. So yeah, so that's where I learned like how to deal with my diet and stuff like that. And at that point in time, like growing up, it was, this is your insulin, this is how much you take, now you eat to fit that. You eat to fit that. No, you don't eat that because that's too much sugar and you don't have insulin for that. So it wasn't till I was probably my later 20s when I met good old Dr. Casper Bell, and Kirk's probably laughing right now. She is the one who taught me how to do carb counting and switched me from good old beef and pork insulin to, you know, the newer synthetics, and how I could be like, hey, there's this many carbs, take this much insulin. And that's when I started doing more than 2 needles a day. Because up until then, with the beef and pork, you just did an injection in the morning and an injection at night, and you did your fast and long acting all in one needle. So there's another big change. And I got put on beef and pork because I was getting a hollow on my leg from where I did needles, and I didn't do them in that spot. So they put me on beef and pork to help plump up the spot that didn't have, where I wasn't doing needles, and it looked like a concave area.
Did you always do your needles in your leg?
At that
I
time,
was told
yes.
to do them in my belly.
As a kid, leg.
Oh, maybe
always.
not enough belly fat.
Well, yeah, and needles were really long then too.
Oh, that's true. Yeah.
Right.
You don't
Yeah,
want to pierce
so-
your intestine doing
Yeah. So it was
insulin.
legs. That is where they taught us to do our needles, was in legs. Oh, and arms. They taught us how to do in our arms too.
When I was first first a diabetic, they gave me those needle shots, pen like shots. I remember having to do them in my legs and arms, but never my belly. But I always had mom do it because I was so scared to do it. But when I was they made me give me at least they wanted me to do at least one shot myself, so they knew that I could do it. But that's what I had.
Yeah.
Cool pen things, but it was still awful.
Yeah. So
yeah.
I didn't start pens till I met Dr. Casper Bell, and she's like, we're switching you to better insulin, and I'm teaching you how to carb count, and I'm putting you on 2 long acting shots a day and 4 fast acting and more if you need it. And I'm like, oh my God.
It's a whole new.
It was, it was like, and I mean, that was also when I had switched from, at supper, I have 2 carbohydrate choices, 2 vegetable fruit choices, 1 protein choice, 1 milk choice, to you have this many carbs. So all of a sudden it's like, okay, now I have to figure out how this works. How many carbs is in a what? Because we had learned, okay, a piece of bread is 1 carb choice. So now it's learning, okay, what's a piece of bread and carbs? How much insulin do I give for this carb thing? So it was a very different thing to learn, but so much better. So much better, because I could eat and then do insulin based on what I ate, instead of here's your insulin, now eat to that, which sucked.
Okay, so Kirk says you should rotate sites, Kim, leg, stomach, back of the arm. For me, it makes the insulin more effective if the sites get to rest. What I do is, I'm going to stand up so you can see my belly. What I do is I will have like a 4 around my tummy. So I'll do this side, this, and here. And that's how I'll keep the quadrants different. And I only have to do 1 shot a day. So now I do. I'm no longer on mealtime insulin. So I will just do a shot and not have to worry about it. So that's...
And that's when I started pens.
Right.
Which have shorter needles. And that's when I got to start doing my stomach too.
Right. Yeah. And I've tried in my arms and legs. Oh, they hurt so much more. Oh man, they hurt. Yes, I'm a wimp.
You didn't grow up doing them there either, though.
That's true. Yeah.
That's to be fair.
I was gonna say I get the whole like life changing kind of thing where you have to change your whole life. Because for me, growing up as a kid, I was used to just eating whatever I wanted and didn't have to worry about that. And then after I got into the hospital, they switched up everything, and now
Yeah.
I have carb count and drink diet soda, which was horrible. Because me
It
also,
doesn't taste the same.
well, the person who has autism, that was
Yeah.
just texture or
Yeah.
taste of that. I had to switch up my entire kind of life in a way and work around this, and it was hard at 13. I can't imagine it at 3 years old though. So
But see, for me, it wasn't a huge thing when I was diagnosed because we
oh,
pretty much already ate that way and did everything that way anyway because of my dad being a diabetic. Like we already ate the diabetic diet kind of thing.
Right.
So
And Kirk says he was at 7 times a day already. So that makes sense.
yeah.
Having to change everything.
Yeah.
When I had to learn, when I got my information pack from my doctor about how to count carbs and that kind of stuff, learning that 1 gram of carbohydrate is offset by a gram of fiber. So if
Yes.
you've got 32 carbs, if 7 of them are fiber, you take 7 off of the 32, and
Yes.
that offsets your carb load.
Yes.
So learning to eat lots and lots of fiber with lots to drink is a wonderful thing.
That is true.
Yeah.
That is very true. I also found like for mine, different times of the day, like because it was so many units per so many carbs, at
Mhm.
different times of the day, my formula on that changed. Like
Mm.
later in the day, it was like a half a unit different and stuff than it was. And certain foods, I had to add more to the equation of insulin for carbs too.
Right.
So it was a fun balance to learn when, you've done this for how many years and all of a sudden it's like, okay,
yeah.
now I'm learning my disease from a different direction. Cool.
Absolutely.
Like being 13 and you've at that time too, my life was crazy. My uncle had passed away. My grandparents were moving out of my childhood home, and my grandpa was being diagnosed with dementia, and then I got hit with diabetes, and just all that life changing,
Everything.
where I was just a regular kid and then having to change my diet. I remember one night I was having spaghetti with my grandma, and we were having to carb count for me, and it was so difficult because I wanted a second helping, but it, I just remember that it was kind of just it was so hard for me though.
Yeah. Having to measure every single thing. It reminded me of my mom being on Weight Watchers or something. Every gram of everything was counted. But Mary is saying that Chrissy had a service dog that was trained for autism, but it actually worked well to catch high or low sugar levels as well. Like being that attuned to you, that is so good.
Well, and I was on the last live that we did. I was telling the story about how I was low one night. I was going to go low. I was 70, which it isn't bad, but I don't know how low I could have dropped. And he was acting very strange. And it wasn't until I tested and ate something to bring it back up a little bit that he settled down. But he was my best bud, so I mean he could tell if my sugar was high too, because he'd just sit on my lap, and then once I pulled out my tester and tested, he'd go away and act like everything was fine.
Okay. So what is 70, Sam?
70 is 3.9.
That is just at I've been told that 4 to 7 is where you want to be. So that is, what would that be, Sam? Like 75 to
7 is about 130.
okay, so somewhere between 75 and 130 is kind of the sweet spot.
For me, I was told you want to be between, for a non-diabetic, you want to be between 90 and 120. And then after you eat, your sugar is obviously, no matter who you are, it's going to go up a little bit because you just ate, and 130 I think is a good number to go up to, but then you're supposed to go back down.
Right. Exactly. Yeah.
That's 5 to 7, Kim.
Yes, 5 to 7. Okay.
Yeah. So yeah.
Okay.
So yeah. So learning was relearning stuff, and it was fun. I I tended to run a lot I used to joke that my machine, they'd ask me, well, what's your blood sugar? And I said, I don't know. My machine just said hi. Or no, I'd say it said hello. And they're like, hello.
Oh,
I'm like, yeah, hi,
yeah,
HI.
yeah.
Which our machines cap out at 33.3, which is 600.
Wow. Yeah.
I still hold, and I actually checked with this recently, I still hold the record at St. Paul's Hospital for walking in conscious and making sense with the highest blood sugar. I was at 89, which I don't know. My chart only goes to 50, and 50 is 900.
So
So I was,
try another 250 on top, like
yeah,
750.
so like 50, so 30, what's 30? 30 is 540. So 540 and 900, I guess.
So like 1440.
Ooh.
Yeah. They're like,
Yeah.
you should be unconscious or dead. I'm like, well, can
Yeah.
we fix something so I'm not unconscious or dead?
Yeah.
I feel really
Exactly.
crummy.
Yeah, for
Yeah.
sure.
So, and
I could,
then my last few months, last year-ish before my transplant was I was having like, you know, constantly I was up in my 30 range, which is like 540. And then all of a sudden I just drop out of nowhere. Like, not because I took too much insulin, not because I hadn't eaten, just all of a sudden
Just,
I'd drop. And like, we'd have an
yeah.
ambulance come and they'd give me a couple dextrose shots, they'd run a couple bags of glucose, and I would, after like half an hour, I'd be up to 1, which my chart doesn't go low enough. 2.2 is 40.
Yeah.
So
So you
yeah,
would have been at like a 20.
yeah.
Wow.
So scary. So it was good that my transplant opportunity came up when it did.
For sure.
And like my hemoglobin A1C, the 3-month test, I I was having a good month of, or a good test, if I was coming in at 14.4, which is 260,
Okay. So
which
still really
isn't
high.
ridiculously high. And now
Yeah.
my transplant doctor hates me because they seem to be about 4.2, which is 75. He's like, I hate you. Those are better than mine. So yeah,
Yeah.
it yeah.
Yeah. With
That's
my dad,
that's like a former transplant, former.
diabetic. My dad had diabetes brittly, and that's what they called it. It was brittle diabetes, because he would be super high and then super low with no insulin, no food, no outside influence. His body would just
Scary. It's
do those
scary.
things. And he actually ended up dying because his blood sugar went down to 0.5. So it would have been at maybe a 5 or 10 on the scale.
Yeah.
And that's how he died.
Yeah.
So his blood sugar just went down and they couldn't wake him up.
Yeah. And
But
it's scary.
before that, for several months before that, he was having a lot of urinary tract infections, so bladder infections. So again, that messes with your blood sugar, your temperature, your white count, and all of that stuff messes with your blood sugar. I mean, like, wow, it is not something to play with.
No,
no,
your
that's
body is very interconnected.
Is it ever?
for me. That's why I was having yeast infections.
Mm-hmm.
And so, but didn't even know at that time I was pre-diabetic. And for me, so my dad, he has diabetes, obviously, and
Mm-hmm.
I'm looking at him because he used to have this big, huge insulin pump with the wires, and I'd be so scared of it and thinking I'll never get that. Well, don't say never. But Oh, and I was going on a trail with this, and now it went out of my head what I was gonna say. um, I had a point. I know I did. Oh,
Happens to me all the time.
Yep. Yep. Kim and I have many conversations like this.
We do, actually.
it completely went out of my head what I was going to say. I'm so sorry.
It had to do maybe with bladder infections or yeast
Yeast
infections.
infections.
Oh yeah, that's why I didn't play around. I know where I was going now. But there was signs before, even before the bladder infection that I was exhibiting that I should have gotten help for.
Mm.
So when my dad was diabetic, he was thirsty, and that's one of the signs that you're diabetic is very thirsty, and that's what my mom was
Understandable.
looking for. However, for me, I was hungry every 5 minutes. Like, I'm hungry again. I'm hungry again. I would go to McDonald's and get a Big Mac, large fry, and large Coke, and then go back and get like a couple of snack wraps because I wanted to feel full. I figured if I ate more, I'd feel fuller. Never worked. Um, then as I got older, went into sixth grade, I things started to progress, and I remember one time because I didn't eat my lunch for some reason, I just wasn't having it, and I remember going down the stairs. And at that point, I had an ankle injury, and at that time, I was going down the stairs, and I just remember waking up at the bottom of the stairs, and I thought my ankle had given out. But looking back, I was shaky, didn't eat my lunch, so my sugar had probably dropped, and I probably had fainted.
Yeah.
Now looking back at that, and I probably should have gotten help for that, but I didn't. And then closer to being diagnosed, every morning for a while, I felt like I was going to get sick. I thought I was going to throw up. I know I wasn't pregnant because I know I
You
wasn't.
knew. You knew.
So, and I would have known if I had done
The
something.
opportunity to become pregnant. Yeah.
Yeah. Um. So it was weird, and I'm like, there's something wrong with me, but I didn't see anybody, which I probably should have. And that's when the yeast infections started coming and not stopping. And that's when I went to go get help. But there was signs that I exhibited for a while, and my mom was looking for signs of thirst, not the signs I was exhibiting. So but when like if you're somebody who is looking at signs that just don't look for thirst, look for hunger, look for other things, because not
Peeing a lot.
Peeing
Peeing
a
a lot's
lot.
a good one. Like drinking little amounts and peeing way more than you drink is a good one.
because my dad had the thirst, but I had the hunger. So
Mhm.
we're both diabetic. So it's like, don't ignore all just don't ignore all the signs.
No.
It's
Yeah.
just,
No.
and I wish I
Yeah.
had gotten help a lot sooner, just because it was a hard and miserable time, not feeling good, from going from probably really high to really low in the morning, because I
Mhm.
didn't know what was wrong. So I figured if I ate a lot more, I'd be fuller. But that was probably aiding the whole highs and lows.
Okay, now I'm going to put this up because I'm a mama and I understand completely. More importantly, you didn't tell your mama.
I think I was scared too, because I didn't
Yeah.
feel like I didn't want to. Well, and I think too at that point when my uncle passed away. I forget when he passed away, but I know after he passed away, I was scared of going into hospitals. I've always been scared of hospitals just because there's a lot of scary things.
And they smell bad and lots of loud
Oh,
noises and
hospitals down in Florida smell really terrible.
oh, do they?
Yeah, there are two hospitals that that were available to us that we went mostly for. They just had this hospital smell, so
Mhm.
it wasn't very pleasant. You came out smelling like a hospital, and then you had to come home and take a bath or a shower because you didn't
Yeah.
feel. But I was always afraid of hospitals and stuff like that, so I didn't want to tell my mom and then have to go.
Right.
growing,
that just made it worse.
yeah. But eventually, I
The
had
irony.
hospital.
Hmm.
Part of me thinks that maybe I could have avoided that whole hospital, that whole night of having to go from the doctor to the hospital and go into the hospital at all if I had gone checked out beforehand. But
It's entirely possible, like just to have been checked out at an annual physical, with your family doctor.
but at the time I was a kid, and so now being adult, I'm thinking like an adult, not like a kid.
Yeah, yeah.
But after you
It's
got
amazing.
diabetes, okay.
It's
My
amazing how much people grow up just in general between the ages of 18 and 25. It's only like a 7-year span, but it's like going from being a toddler to being in junior high. And that sounds really awful from somebody who is old to somebody who is young,
but
but it is true.
I've grown so much since I was 18 years old.
Yeah,
So I it,
yeah.
but
Mom gets a lot smarter when you're around 23.
yeah, you get every year you get a little bit smarter. But
Unless, of course, you're Sam's mom, in which case. Yeah.
but
My grandma though. My grandma.
Ah, yes.
my grandma's very smart too. But at
Yeah.
the hospital, they did scare me though.
Hmm.
Because I wish at the hospital, I know they got to tell the patient too, but I was a kid, and
Yeah.
they were telling me all the bad stuff that could happen. And they were in the room telling my mom all the bad stuff that could happen. And I'm like, do I need to be a part of this? I'm like, I just got this.
Yes. The answer is yes. You did need to be there.
I know, but it was, I don't know.
It's a lot.
It scared me though. It was a lot going on. It scared me. It was just like, because I was afraid to do any exercise because I didn't want to. Oh, that scared me. I just saw something moving, and I was just
Penny, the cat.
It's Penny. It's Penny. Sorry.
no, you're fine. I just saw something moving in the background. I'm like, what's
It's
going
not a rat.
It's hyper time.
Mm.
She's like
Yeah, no,
racing
it's
up and
fine.
down the hall and running around me.
the zoomies?
Yes.
The zoomies.
But yeah, it's for me, like, exercising was scary because I didn't want to go. I don't want to have to, like, I didn't want to go. I didn't want to crash.
Mm-hmm.
Have the possibility of calling the ambulance and passing out and all that stuff. So exercising
Mm-hmm.
that was scary. Um, I don't know if you all felt this, but for me, like, when I was coming home, when I was home from the hospital eating snacks,
Mm-hmm.
I felt like I couldn't eat snacks because I didn't want to have to test.
Right.
And I was like, when if I eat a snack, do I need to test? And it's just like I felt like I couldn't eat a snack. I don't know if that was for you guys.
Yeah, I was scared to eat a lot of times. And now I've simply learned that I want lots of protein. So I've got like this much of instant coffee, and it's like 3 tablespoons because this is a 3 cup cup. So three teaspoons of instant coffee with water, a protein shake to there, and then the rest is with oat milk. So it tastes like I'm drinking a huge chocolate milkshake, except it's healthy, And so something like that, it takes me 2 hours or more to drink all of this. Like, you don't just want to chug it, but it helps to keep my sugars at a reasonable rate and
And I
give
find
me the amount of protein I need.
the more protein you eat, the more my sugar, especially, is a lot more steady.
Mm-hmm.
Or protein I eat.
Yeah.
So I've decided.
Protein and fiber.
And for me, I think I've decided to go more to a protein diet where I eat a lot more protein and a lot less bread and stuff like that.
Mm-hmm. Mm-hmm.
Because I find it helps my sugar.
Yeah, absolutely.
Something they told us at camp was when your sugar's low, eat some carbs, drink some juice, something like that to get it up. But have some peanut butter, have a stick of cheese or something because that's what holds
Mm-hmm.
it steady.
That's what
Mm-hmm.
they told me, like peanut butter and crackers, cheese or cheese and crackers, peanut butter and apple, something to go with it if you're gonna have a snack or something like that.
Peanut
Except
butter and banana is fantastic.
no,
No?
just for me, no.
Oh, okay.
You don't
Bananas and me do not get along.
banana.
Oh, okay. Well, that would be your kidney thing, wouldn't it?
No, I just get
Oh, you
horrid
just don't like-
heartburn.
Oh, okay. No, for me, I would have my breakfast would be a peanut butter and banana sandwich. So 2 pieces of good whole wheat kind of bread.
Yeah, that's the only
And-
bread.
Yeah, and then peanut butter, lots of peanut butter, so the tons of protein in there. Banana, oh my word, delicious.
I miss those so much.
Me too. Yeah.
Peanut
Hola,
butter,
Maritza. Sorry.
I said peanut butter sandwiches are good. I had one this week and it was fantastic.
Oh, sure, brag. No, I had.
I could go have
Sorry?
one. I could go eat one. We have a giant Costco container of peanut butter.
Squeeze your head. Squeeze your head. I had bariatric surgery a few years ago. And so now my stomach is only about the size of a walnut. And yeah, so I can't have a big sandwich. Like, and to me, just a regular sandwich would be a big sandwich, you know? So that's also why it takes me 3 or so hours to drink through all of this. Most people could drink it much more quickly.
And why we go
But,
for appetizers, not for lunch.
Exactly. Yes.
It's
So-
also cheaper.
Mhm.
Also, another thing that works well to bring your sugar down, because my sugar was up one day. My husband's like, he was looking up stuff to fix for me to bring my sugar down. He's like, lemon water helps.
Yep.
Lemons. So he fixed me a big thing of lemon water, but I was looking it up myself because I was curious about something. And I guess no matter what, if you're a diabetic or not, if you drink a cup of lemon water before your meal, each meal, you will feel fuller and not eat so much.
Oh,
Helps diabetics. The lemon helps diabetics with their sugar. And then cinnamon. I love to add cinnamon to about like everything, like oatmeal, cinnamon. I'll put cinnamon on it. My milkshake, I'll even add cinnamon to it.
See, I'm gonna argue the lemon thing that doesn't work for everybody, because I literally used to sit and eat lemons like oranges, and still my blood sugar was way up there.
sky high.
Yeah,
But
but
maybe it's the
I'm not
dilution
saying
of
it
the.
didn't work for a lot of people. I'm not saying that. I'm just saying,
For everybody, different.
Yeah.
as you said earlier, everybody's different.
For me, it brought my sugar down a little bit, not too much. It didn't bring it down where it needed to be.
Cool.
But I just like drinking lemon water because one, the water doesn't taste so watery.
Exactly.
I don't know how else to describe it.
No, that's exactly
We get it.
But it also helps me feel fuller too if I have lemon in my water.
So Mary says we keep Uncrustables and peanut butter and jelly sandwiches in the freezer for Josh, so we can pull those out if he needs to raise his blood sugar. That's a very good point. Just having something on hand. Frozen grapes are also excellent. So yeah, that's something that. Oh, I can't take that call. Frozen grapes are excellent as well because as you freeze them, the sugar content goes higher.
But hey, if you need to, a glass of water with icing sugar works.
And apple juice, Josh says, yes.
My poor
Okay.
roommate.
So, Samara, tell us about the 3-day conference.
It was a 3-day conference.
Yes.
So I was in the hospital and I hadn't seen my nephrologist, which is my kidney specialist yet, who was always the one who like came in and the first thing she'd do is change all my orders and write down that Samara gets control of her own insulin. But I was still doing it and I was sick to my stomach. I was not keeping anything down. So I was doing what I was taught for sick day things. You watch your blood sugar and you just do little amounts of insulin at a time, and you just check frequently and do little amounts because you don't want to do too far when you're not eating anything, right?
Yeah.
And the doctor who was on the unit comes in, and she's like, "What are you doing with your insulin?" And I explained it. She's like, "That's not how insulin works." I was like, "Excuse me?" She's like, "I took a 3-day conference a little while ago, and that's not how it works. I know how this works." And she goes on to explain. I said, and she's like, "Did you take a course on this?" I said, "Well, I've lived 36 years of it, and this is how it works for me." And she's like, "That's not how it works." And she like storms out of the room, and my nephrologist was standing outside of the room at the time. So she came in and she's like, "Yeah, what were you thinking? You didn't take the 3-day course." And for years, that was our big joke about everything is I'd be like, "This is what I'm going to do to change this." And she'd be like, "Wait, did you take a 3-day course on that?" And it's like,
Yeah.
maybe that's not what they taught you, but for me, that's how it works. Like, because they wanted me to take this giant whack of insulin. And it's like, yes, my blood
Not a
sugar is,
blood sugar
that
level.
might, well, it's like that might be appropriate for where my blood sugar is and what your little sliding scale says, but I'm not eating. So if I go too low, you can't give me anything to bring it back up.
Except for an IV of glucose,
Yeah.
which
And
just is.
And yeah, so, and we know from history at the hospital how when the hospital has control of Samara's insulin, we end up with the code team being called because I'm having seizures because my blood sugar is so ridiculously low, and they're blowing veins, pushing dextrose injections into me.
Wow.
Which is why as soon as I came into the hospital, I'd be like, "Call Dr. Clausen." And she'd come in, and first thing she'd write on the top of my chart is, "This patient has control of her own insulin."
On
And I
it.
was and I
Oh,
was lucky enough that like all my surgeons and stuff were like, "Oh yeah, Dr. Clausen wrote that. We leave that alone. We don't touch that." Except for the one surgeon who, knew better on everything.
I found for me a lot of doctors in Florida were they were horrible. Like the first doctor that the endocrinologist I had, because I had to go to I forget what it was because I wasn't an adult yet, and this was
Pediatrician.
well, not a pediatrician. There was some special word for it, but an endocrinologist that uh dealt with kids. Um, she was terrible. I think at one point in the hospital, she fussed at my mom for giving me, and mind you, my mom didn't give me 2 double cheeseburgers at the hospital. There was, in the past, before I got diabetes, there was a couple times I got 2 double cheeseburgers. And she literally fussed at my mom for doing that in the past without knowing I had diabetes. And so we didn't like her from the start. And then I think she was going to suggest a medicine that would give me like I want to say it's hepatitis C or something like that. No, hepatitis C or something like that. Um, and she wanted to give me that, and my mom's like, "No, we're not taking that chance. I don't want her to get the side effect from this medicine. She's already got enough on her plate." And it was like we kept switching doctors because they just weren't that good. And
A lot of them don't learn, like they like, especially with like GPs, they learn a little bit of everything, but
Mm-hmm.
a lot of them, like, I know my family doctor, I was very lucky because if he had a patient that had something like diabetes, when my dad was diagnosed, he sat down and started reading up on everything about diabetes. So like by the time he was dealing with me, he's like, "Well, do you want to go to an endocrinologist about dealing with your insulin? Do you want me to help you?" I'm like, "No, you can help me. You know what you're doing." He also wasn't afraid to be like, "I don't know about that. Let's learn about it together." So I was
Yeah,
helpful.
Josh says, I hate DIA smarties. Y'all know what I'm talking about. The ones who know everything about diabetes but me. I'm on a pump, so they can't control my insulin.
Yeah.
Yeah, like there was one doctor, was like there was two doctors I can mention in Florida. One doctor we went to was terrible, didn't listen to anything we said. We ended up quitting and not going to him because it was just awful. And then another doctor, endocrinologist that I had, and I should have called the police that day because apparently there was somebody who was allergic to dogs, and at that time I had my service dog with me, um, with me to go in because I was pretty scared.
Yeah.
And I was just done at that point. And I remember a lady coming out and saying, you can't bring the dog back here because there's somebody allergic. And I'm like, and I, at the same point, I get that, but he's my medical equipment. He is my service dog. You cannot deny him access to where I need to be.
Yeah.
And she kept denying. She's like, you're going to have to walk out, sir, or something like that. And just kept denying him. Wouldn't let him back in with me. Wouldn't even let my mom be on a phone call with me. And while we were in there, she's just so rude. But what really pissed me off is she was denying access to my service dog, which by the ADA law, you cannot do that.
Yeah.
No, that's like telling somebody who's in a wheelchair they can't have their wheelchair.
Exactly. I know, like, autism isn't technically a really serious medical issue, but it's like, would you deny a blind person or somebody with seizures their dog?
That's right.
Exactly.
Well, that one was apparently the nurse who was afraid of the dog. Not.
I swear that the nurse was allergic, but I don't know.
Or she may have said she was allergic just to say she.
The point being, it was a service animal. It wasn't an emotional support animal. It wasn't I miss my puppy. It was a service animal.
Absolutely.
But I should have called the police that day or the non-emergency number, because they needed probably to learn the lesson of, you do not deny somebody their service dog. But that was just an awful endocrinologist. However, she was the one that told me, because I had lost a lot of weight at that point, that I did not need my insulin pump, because my insurance wouldn't cover that either, which was crazy. But I did not need my insulin pump, and I could switch to medication. And it's the medication I'm on now, and I'm going to try to work on losing weight so that way I can stay on this medication instead of having to go to shots.
Yeah. Just to plug the yoga lady that I just had on, Candace. If you want to do yoga with me once or twice a week, online, it is a Zoom call and it is chair yoga, so it's easy to do. And with a purchased monthly membership, let me see if I still have her banner in here.
I watched her do it today. It looked pretty easy.
Yeah. And Sam has one leg.
Notice I did not take part. I watched.
Yeah, no, she did not. No, did not take part.
Anyway.
I was texting on my phone.
She was.
He
was talking to boys.
I was talking to boys.
Yeah. No, anyway, so if you want some information about an exercise program that is doable with an instructor who is not a little teeny weeny little thing, she is a plus size girl like us, but she's been a yoga teacher for the last 14 years. So she's in shape. She just is curvy shape, right? So yeah, if you want to, pardon?
I said that is a shape as well.
That is a shape, absolutely. Yes. So if you want more information on that, I can give it to you. If anybody else wants more information on that, email me at, there we are. My other's keeper is at gmail.com. Okay. So yeah, that's something that you can do let me know if you want her information, because it is, first of all, in Canadian dollars, it's cheaper for you. So
I like that.
yes. But anyway, yeah, let me know and I will hook you up so you can get really easy, really effective fitness without, killing yourself and killing your wallet. So, yeah. Yeah,
Because I like something that doesn't kill my wallet.
that's for sure.
I agree.
Yeah.
My wallet's half dead anyway.
Yeah, mine needs life support.
Yeah, starving as well.
Yeah.
Plus, my took out $1.50 in change, so it's like more hungry than I already was.
Mm-hmm.
Yeah.
So, Sam, what is your takeaway when it comes to dealing with diabetes in your case?
It would have been nice to, and as much as I grew up with a dad who was a diabetic, he never talked to me about his diabetes ever. Ever. Other than you can only eat this much of this and don't have that and stuff like that. When I saw him on Sundays, like, you can have half of a super soft taco at taco time. You can have 3 Mexi fries. But like, he never really talked about, we talked about how, like, I grew up mostly with my mom's parents, who were amazing and supportive, and like, my grandma bought the diabetic cookbooks and made sure she learned how to do that. If she had a recipe she wanted, she'd send it into the dietitians to get it switched. They were awesome. My dad's parents, on the other hand, were just suck it up and deal with it. I'm not doing special things for you. You can just learn how to deal and adapt, which I threw back at her when she got diagnosed with diabetes and phoned me complaining. And I was like, yeah, suck it up, deal with it, and hung up on her.
She was not a kind lady.
No, she was not. Like, she always was, literally, she'd be like, just deal with it, suck it up, don't be such a wuss. So yeah, when she started having nerve damage problems in her feet, she's like, I don't understand. Why does this hurt so much when your feet are numb? And I said, yeah, well, that's diabetes. Suck it up, deal with it, and hung up. I'm like, no. Oh, sorry.
The
No.
shoe is on the other foot, is what you're saying?
Yeah, literally. But I wish I'd had somebody that would have talked to me who was a diabetic to explain, like, you need to watch your blood sugars, because this is, like, it's one thing to hear it from your doctors and you're like, yeah, okay, so you read about it in a textbook and you're telling me about it. Thanks, that's great. You've seen patients, great. But you haven't lived what dealing with that and what it takes to get there, what it takes to watch your food, to watch your blood sugars, to do your insulin. Like, it's different.
Daily thing. It's not just, it's a daily thing that you have to do. And for me, I'm lucky to have my dad, because there was a couple times I'd be crashing and I'd go to him and be like, I don't feel good. Do you ever? And it was nice to, like, go to him and just ask if he's ever felt this way and feel like I was understood.
Yeah. But
So,
my biggest thing is, it would have been nice to have that, so that I might have been better at taking care of things. So I didn't have nerve damage as soon. I didn't lose a leg because my stupid burns turned into losing a leg. I didn't have kidney damage as quickly. I wouldn't have gastroparesis. It's, as I've always said, diabetes itself is not so bad. It's all the extra side effects and all the extra gifts that diabetes gives you that suck. It suck a lot. And even though I'm not technically a diabetic now, I still have 39 years of diabetic damage that I'm still dealing with. Hence why I get to go on Thursday for another eye checkup.
Tell her about your eye checkup, honey. Actually, hang on. Before we do that, Mary asks, what advice would you give each other as ways, I'm assuming it's supposed to be WAYS, ways of preventing things from happening from diabetes? I think what Sam just said is really important. Pay attention and don't take
watch
it for
your
granted.
kids.
Yeah.
And if you need help, ask for help.
Yeah.
Ask for help. That's the
Yeah.
biggest one. Because I know, like, there were so many times where it was like, I just don't care. I'm tired of dealing
Mhm.
with it. I'm
Yeah.
just not gonna do insulin today because
Yeah.
and yeah, I regret those all now.
Christina, what would you say?
But one of the things to remember is that we are still human. We still crave things like chocolate and stuff like that. And as
Sam hates chocolate.
I do.
okay, well,
All the
whatever.
rest of the world, you can crave your chocolate.
Well, okay, so like whoever you are, and you crave something, or just for everybody, it's different. Like for me, I love chocolate. I love sweets. And I feel like losing weight to like with that whole thing of being on diet, it's so hard to cut cold turkey. I've tried. I did that once and it was awful. I think what you got to remember is that because there's a lot of stigma around diabetes being you can't have sweets, you can't have this, you can't have that. And to a degree, you shouldn't have a whole container of Kit Kat bars or a whole bag of gummy.
No, you really shouldn't.
All of those lollipops, right, Sam?
Oh, my mom.
But like whatever it is, you shouldn't have a ton of it.
Right.
So I'd say like don't stop from eating something like a Kit Kat bar or a lollipop or cheesecake, but don't have it in moderation.
Or even not even moderation. Like if your diabetes is bad enough, moderation might be 2 forkfuls instead of half of a slice, right?
Yeah. Well, it depends for you what moderation is.
Exactly. That's right.
Don't
One of my specialists said you can have anything you want. It's how much you can have.
Mhm.
Yeah, I think that's what Chrissy was just saying.
Yeah.
Don't stop yourself from having anything like once in a while, and don't have it every day.
No.
But because we're all human, and we all want something like once in a while, a treat, but don't overdo it. Take it in strides and moderations and however you need to do it. But
And
don't
watch your
stop,
blood sugars.
because that's for me. When I was firstly a diabetic, that's what I felt like. I had to stop all of that.
Yeah.
But that's not the case.
No. Some people, though, are very all or nothing kind of people. And for them, if they can't do moderation.
Yeah.
They only can do the yes or no. And that's their personality. So
if you can handle it, if
yeah.
you can handle it, then I'd say, I guess for me, like I don't want to cut something out cold turkey,
Right.
Because I know I'll go stir crazy.
Oh yeah.
But yeah, just don't let it stop you from having a treat once in a while.
Exactly.
Watch your blood sugars.
While.
Yeah.
Watch your blood sugars.
Yes.
The one piece of advice that I would give is pay attention to this piece of advice that a doctor told me. He said, liquid sugar, like pop, is still sugar. In fact, it's even worse because it is liquid and it goes into your system so quickly. The crystals of the sugar have been diluted, but they're still crystals. So what's going to happen is they're actually going to wear away at your blood vessels as it's going through your body. So it's not just liquid like water going through your body. Those sugar crystals are going to wear away at your vessels because it is still crystal, even though it is liquid. So that was something that I had never thought of. And when he put it that way, it's like, okay, yeah, that does make a lot of sense. So, yeah.
Well, and there's ways to unwaterify your water.
Yep.
Like put lemon in it, put some juice in it.
Yeah, I'll have this much water and then this much apple juice just to give it that, unwaterify it. Yeah. Get rid of that flavor of the water.
And my struggle with water is after years of you can't have more than a liter of fluid, watch your fluids because of kidney damage, and everything counts to that, an ice cube, a
Mm-hmm.
jello because it melts into liquid, pudding, everything, soup. Now, because of my transplant, I'm supposed to be having at least 3 liters of water a day, and I struggle with that so bad. But I'm not alone. They laugh because they said that's they have that problem with everybody because you've been
Yeah.
restricting yourself so long. So yeah, yeah,
Yeah.
fun,
It's
fun.
easy to overdo it when you've been restricting yourself for so long, right? So, yeah. Josh has made several comments. In particular, what works for one doesn't work for everybody. We've been saying that the whole night. That's exactly right.
Yeah.
So, he has to go medium, medium, medium amounts. So, equal amounts of carb, vegetable, and meat or protein rather than lots of
Exactly.
protein, like that kind of thing. It just depends on your body
It does.
constitution.
It does.
And he's right, it's not for the weak. He went from basic diabetes to severely insulin resistant diabetes. And that's where, man, that's your whole body deciding it hates you. So, yeah. And Mary gives great advice. Lean on each other and give each other support and listen to one another struggling with it. So, Chrissy, if you need to talk to somebody because you're frustrated and whatever, Sam is an amazing young woman to talk to because she, first of all, is on her phone all the time. So she will get
What?
your message.
What?
No
Don't
Even
idea
worry.
when
what you're
Kim's
talking
doing
about.
yoga. Even when Kim's doing yoga, I'm on my phone.
That's what my says. I'm on my phone all the time too. So,
Yeah.
but no, I appreciate
So,
it. And the same with you guys.
absolutely.
It's not the worst disease you can have.
No.
Because I've seen worse, like with my grandpa who had dementia. I've talked
Mm-hmm.
to my aunt who has cancer, so it's not the worst disease, but it isn't the funnest either.
It's the
Yeah.
things you can get if you don't watch your blood sugars that are the problems. Those are
That's
the bad
right.
things.
And the daily task of trying to keep it level.
The amputations, the damage to
Yeah.
your eyes.
Oh, yeah. I stopped you from telling her about your eyes.
Oh,
Tell her about your eyes.
okay, so I have diabetic retinopathy, which your eyes are the only place in your body that if they're not getting good enough blood supply, grow extra blood vessels, but they're very brittle. And then they burst very easily, and that can cause you to go blind. Yay. Um, so originally what would happen is when I started getting those blood vessels is you would go in and they'd do lasers with it and they'd go zap, 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 and they'd go along and zap the blood vessels and basically like cauterize them all off and stuff. And it's not a pleasant experience. And they've now found that that leaves scars in the back of your eye. And for every scar, it blocks spots in your peripheral vision and it causes problems with night vision. So now what they do is they do an injection into your eye of a medication, yay, but it's not covered for us here, unlike the laser surgery is. And my last round of needles was um, not fun because I've had these for years, like years. I think my first one might have been in like 2006 probably. Um but the last one something wasn't feeling right and by the end of the day I'm like, wow, my eye feels like there's gravel in it and it's getting more and more sensitive to light instead of the dilation drops wearing off. And the next day I went in and they were worried I had an eye infection, so they were doing tests, and I got dilation drops and steroid drops and antibiotic drops. And then they sent me over to the emergency eye center at the hospital because they were looking at having to do a biopsy of my eye and inject antibiotics straight into my eyeball. So fun. Thank God all the drops and the medications and antibiotics helped. So it's been slowly over the last 2 weeks getting better and better. And I go back on Thursday for my next checkup. And I go back for my next needles 2 weeks after that. Yay. Yay.
Yay.
I don't know.
Praying that they don't go bad this time.
Yeah.
I just keep imagining needles going into your eyeballs. Oh,
It
that's
kind of feels
Exactly.
like they freeze it and stuff, but it kind of feels like they pinch it. That's kind of what it feels, is like a pinch.
ew.
But the lasers, they hit like 2 or 3,000 times with the lasers, and each time it hits, it feels like that. So it's like lasers, 2 or 3. It's probably only like 200 or 300, but it feels like a million. Zaps, where it's like zap, 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 and each one of those is hurting the same as one needle. I'm like, one needle feels better than hundreds of needle feels. But
Oh,
yeah,
Yeah.
it's weird. But they freeze it. They freeze it.
my sugar a lot more. You definitely have done a great job.
Yeah. Trust me.
Something else that I think is really important to know, that is one of the best ways to find out if you're diabetic is with your A1C, but the other one is to see your optometrist, because your
Yes.
eyes will change before the rest of your body catches up.
The
So,
So
optometrist.
even if
the
you can
optometrist-
see just fine, go to your optometrist.
I used to work for an optometrist, and he quite often would be like, go see your doctor. You have diabetes. No, I don't. I'm fine. He's like, go to your doctor. You have diabetes. Trust me. And
Yeah.
they'd phone back and be like, yeah, you were right.
well, and if you another thing too is if you feel like you are having symptoms, you can go get checked for a marker to see if you're going to have it or if you're not going to have it too. Which I'm telling you what, they gave me this orange stuff to drink, and like I was the next day I had a friend coming over and we played Candyland, and every time I looked at that orange color, I felt sick to my stomach.
Yep.
Like, oh fuck, it was awful.
Yeah, we're
Like,
familiar with that one.
trying to hold my food down, being like, nope, nope.
3.5-year-olds don't like that stuff either. Let me just tell you
Nope,
that.
neither do 10-year-olds.
Nobody does.
Yeah.
No. I don't think anybody likes that stuff. Let's be serious.
Yeah. Is that
If
pure
you-
glucose? Is that right?
Pretty much.
Yeah.
And then
It's a
they
glucose drink.
try to flavor it.
Mm-hmm.
Even worse. And color it
Oh
orange.
yeah.
You're playing Candyland and you're seeing the orange color and just it's awful.
You ruined my childhood game by giving me this crap. Thanks, guys.
So our takeaways: check your blood sugar so you don't get needles in your eyes.
Yes.
That's a big one.
Or lose limbs.
Yes.
Or which?
Or lose limbs.
Or lose limbs. Yes. Yeah. So
Or get
lose limbs.
gastroparesis or kidney damage.
That's
I
I
right.
could go through. I have a long list of things that I have because of diabetes. You don't want
Yeah.
any of them.
Yeah, if you're diabetic and you have a cut on yourself, make sure you, as soon as possible, can put some antibiotic cream on that cut, because it's just another step to preventing it from getting further. Like I had I had a dog at my work who bit me like right here and here, and it was awful. I don't know if you can see the
Oh yeah. Yep.
It's
See
finally
it on your middle
up,
finger.
but once I could get to doing it, I put antibiotic cream on those too, and that helps. It helps heal up the thing faster, but it also prevents infection, which I highly suggest, especially if you're diabetic.
Because
Yes.
infections are harder to heal. when
They
you're
are.
Well, that too, it takes longer to heal, and a simple cut can just. I mean, I
And
got a cut on my foot one time, and I went to go see the doctor for something completely different. And she looked at my foot and she's like, "What's this?" And I said, "I got a cut because I was swimming and cut my foot on rock." And she didn't. Wasn't even going for that. And she grabbed something from that orange stuff, to the cleaner to put on my foot. Did that so my foot would be all clean and not get an infection. So I knew I was diabetic because that's my regular doctor. So always try to put
Well,
bad.
and because if you don't take care of that, that's also going to throw your blood sugars off more, which is going to
That's
mean
right.
it doesn't heal worse. It's going to take even longer
Yeah.
to heal if your blood sugars are high.
Terrible vicious cycle. Oh my goodness.
And then you end up with like that.
Yeah, what she just did, only without a foot. Yeah. So
Yeah.
Josh said he had gastroparesis before he was diabetic. I'm wondering if
that's
maybe it was,
That's even
yeah,
crappier.
no
I'm
doubt.
so sorry. I'm so sorry because it sucks.
Yes. Anyway, thank you, ladies, for coming on. Chrissy, you can hang on for a little bit when we're done. And thank you, everybody, for watching. Just going to give you a minute here. If you have any questions or something like that, just go ahead and ask. I'll leave us going for another couple of minutes in case
Well, damn.
we'll just dance.
Ooh,
Woo,
I,
woo,
oh.
woo, woo. Anyway,
Raise the roof.
raise the roof. We are old and white. Yes.
Oh, ouch.
Sipping my water,
Pardon?
sipping my non-watery water.
Protein
Your
shake.
non-water.
Love
Protein
water.
shake in Starbucks cup.
We're pretending it's Starbucks, but it's literally just water.
Yeah.
Yeah,
It's not non-water water either. It's just
it's
water.
just water. Okay.
Water.
All right. So yes, thank you, everybody. Thank you for coming. Thank you for chatting with us. I appreciate it. And we will see you again on Thursday this week. Just going to grab my calendar. Thursday this week, I'm going to be talking to Leanne, and she does prison ministry at our local women's prison. And by local,
wow.
I mean 2 hours away. So yeah, come hang out on Thursday. Come hang out on Thursday, the 28th of March, and we're going to have a good old chat.
And then
Talk to you later.
Friday. And then
And
Friday.
Friday. Game day Friday. Game day Friday. Woohoo! Trivia. Alrighty.
And we're terrible at it, so feel free to
We
join.
suck. We suck. We suck. Except for Sandy Wandy is here. And
Yeah.
she is amazing.
Yeah.
Sandy is amazing.
She put us all to
Sandy,
shame.
if you come again, you can amaze us with your trivial knowledge.
And you can hear about squirrels.
Well,
You
Friday
can hear about squirrels.
Friday.
All right.
have an Easter with my parents, so.
Yeah. Oh, that's awesome. Yay.
Yoga.
Talk to you later. Bye-bye.
Bye, everybody.